You say yes, and I say no. You say yes, and I say no, no, no. It happens all the time. A 27-year-old female comes into my office, and this is a fictional patient, but sort of a composite. She comes in, she says, "Doctor, I am depressed. I am so depressed. I need something right now. Please give me Prozac." Well, I could easily take out my script, take my pen, and write for Prozac for her. But the reality is this requires a little bit of looking into. You can't just sort of jump. And because somebody says, "I'm depressed," it doesn't necessarily mean that they are truly depressed to the point where they need to be swallowing pills. In fact, many people say when I ask them questions, my brother-in-law is sick, my children are having a hard time at school, my husband, he's a workaholic, and so I'm depressed. Give me some Prozac. You say yes, and I say no. So of course, this requires looking into the situation a little more closely, because I, in general, like to not give people medication if we really don't need to. In fact, people will show up in my office sometimes already taking psychiatric medications, sometimes 4 or 5 or 6 psychiatric medications, and in my mind, it can be quite ridiculous. So I always look at trying to get people off of medications, possible not even giving them medications in the first place if they really are not warranted. Obviously, if they are warranted, then we will give them medication. A few things to look at, and mainly it has to do with lifestyle. I'd say 90% of the time that somebody comes to my office professing or saying that they're very depressed, I do ask them, "Do you exercise?" And the usual answer is, "Nope, I don't exercise. I just don't have the energy. I just don't have the motivation to exercise." So then we look at other things in their life that may be contributing to their lack of energy, for example. We look at sleep. Sleep is vitally important. Most people we know need to get 7 to 8 hours of sleep every night. It's always best to go to sleep basically the same time and wake up basically the same time. But people do all sorts of things to undermine their sleep. For example, people will have caffeine. They'll have their coffee first thing in the morning. That energizes them. Then after maybe a few hours, 6 hours or so, they begin to feel sort of tired. So then maybe they'll have another coffee. Lo and behold, before you know it, some people claim I can even drink coffee in the late afternoon and be okay. But it does wreak havoc on somebody's sleep. It disturbs their sleep cycles, and therefore will deplete their energy because they aren't getting a good quality sleep. Nutrition, of course, is vitally important. We need calories in order to feed the body and also to feed the brain. And if people aren't eating adequately, then that's a big problem as far as their energy goes. On the other side, people who are overeating, because many people, sadly, they overeat because they're trying to fill some kind of emptiness or void inside of them. Comfort eating, for example. But the question of exercise is a crucial one, because I've learned and I've seen so many times that people who exercise regularly do not fall into the depths of depression nearly as much. But people say, "I lack motivation." So what has to happen then is what we call behavioral activation therapy, meaning start to do the action. And once you start to do the action, then the feeling will follow. They say, "Doctor, I just don't feel like exercising." Well, of course, many people don't feel like exercising. And if you follow your feelings, then you could go for years without exercising at all. The trick is to begin to do the action. Get yourself into action mode. Forget about how you're feeling about it. And most of the time when you get yourself into action mode, then the feeling will begin to follow. People have seen this time and time again. And so what I found is I say to them, "Look, I don't think you need Prozac." They may get upset at what I'm saying. Why don't you do this? Why don't you do some kind of exercise, even if it's just walking down the street for the first couple days, then try to extend it. Try to do a brisk walk. Try to do something aerobic if you can. Every single day, 6 out of the next 7 days. and then come back the next week and we'll see where you're at. Obviously, I try to instruct them on sleep and on appetite as well, but sometimes you can't do too much. So lo and behold, some of them don't show up the next week because they so much want their Prozac. They think Prozac's going to be a piece of nirvana for them, and so they don't show up. But most of the time they show up. And most of the time when they show up, lo and behold, they say, I'm feeling a lot better, and you're right, I don't really need the medication. You say yes, and I say no. You say yes, and I say no, no, no. But the reality of the situation is there's much more to this, because if a person really wakes up every day with a sense of purpose, why they're alive, this is another subject I talk about with them. To know what you're doing in this world, to know where you're going, to have a sense of purpose, to connect with the inner part of you, your soul, will go a long ways to having that strength and that resilience so that when things happen, you still have the freedom to choose your attitude no matter what comes your way.